Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no copay. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hello, everyone. Can you believe it? We're in January of 2025. We survived 2024. We made it, and now we have our work to do to get back, those New Year's resolutions, take off those few pounds we may have gained during the holidays, having Aunt Betty's cookies or whatever. So I'm really excited about this year. We have a lot of great podcasts coming up, and specifically want to thank my sponsors that have brought these stories to you, from the very beginning, from our fragile beginnings here with no listeners, and we've grown and things have been so great. And so Keto Mojo, great company, they helped us get us through that first year. They agreed to that first year of sponsorship, and that was fantastic. And so they're still my go-to for Keto Mojo for ketones and sugars, and greatly love the company and the owners. They're fantastic people, so continue to support them. But this year we're focusing more on Health Code Get Health. Fantastic company started by Ben Bickman. Their protein formulas were designed by him, and his brother Joel Bickman has taken over the company, and he's doing some great stuff. Great people, just really, really good. I'm so honored to be associated with them. So the big things we're talking about this year is berberine. They have a special berberine that I like. Berberine helps with insulin sensitivity. We're using it in our pre-diabetics and diabetics, those of us who have metabolic dysfunction, which is about 93% of us or so, especially after the holidays, probably 98% of us maybe at this point. But their berberine is very special. It has turmeric and broccoli seed extract, which is what I'm using right now, and I love it. It's supposed to work as an anti-inflammatory and help get that body a little bit more sensitive to sugars and insulin. So that will help us on our journey. Also, they have great protein shakes that our own Chris Cornell has been using, and he's transformed. He's actually doing some commercials for them this year, which is pretty cool. He's really changed his life. You can go back and listen to that episode. He's a fantastic guy, and he's been a huge supporter of the podcast. And also, they have the fermented pea protein that they're using now for people who are more on the vegan side or vegetarian side. And then they have the old faithful, the chocolate macadamia and vanilla. Great shakes. That's what I use after my workouts. If I go on a long ride, that's my recovery drink. So everyone, please support them. We greatly appreciate them. That we have discount codes on our website. If you go to ArizonaMetabolichealth.com, we have connections, discount codes, all that kind of stuff. And if you haven't signed up for our newsletter, please do that, and you'll be apprised of everything going on and be on the Insiders Club here. And for our Patreon supporters, thank you for getting us off the ground, helping us to get going, and paying the editors and the video guys and all that kind of stuff. Greatly appreciate your support. It's less than 1% of listeners, so I'm hoping that a few more people say this year they want to help out and get some more stories coming out here. But hey, happy 2025. Let's attack this together. And again, thank you, Health Code, Get Health, GETHLTH.com. Both of my parents are on it. I'm using it with my senior patients and really helping to build some muscle mass and get some good nutrition. And we're seeing amazing results. So thank you all and enjoy this episode.
Discover a new path to wellness at Arizona Metabolic Health. Dr. Brian Lenzkes offers advanced medicine and personalized care, treating the root causes of your health concerns, not just the symptoms. Whether you're seeking direct primary care, effective diabetes management, or medical weight loss, with a holistic approach, our team is here to guide you every step of the way. Visit ArizonaMetabolichealth.com today to learn more about our innovative health solutions.
Hello and welcome back to the Life's Best Medicine podcast. I roped a local to come join me, Tammy Frost from Grace Direct Primary Care. We're in the same town here, and we're in a networking group, and we just started talking. I was the new kid, so I was kind of like, I don't want to step on anyone's toes. I want us to kind of see how we all fit together. So, Tammy, tell people what you do and how. Let's start with what got you into medicine in the first place.
So I have always been involved with healing. My whole life, my parents always said, "You're a natural born healer." So I've always worked in the helping fields. I've worked in lots of fields. I've worked mostly in rural primary care, so mostly rural family medicine, but I've worked in several concierge practices before opening my practice here. I've also worked in neurology, interventional pain management, urgent care, physical therapy clinics, chiropractic clinics. I've worked, let's see, so many places, nursing homes,
Wow.
rehab
So you've
centers.
you've been you've seen a lot.
Yeah. And then, of course, I went to King's College. So they are one of the best programs in the nation. I competed with 1,600 people for 12 spots.
Wow.
We took 35 medical classes in 10 months, and if you got less than a 91%, they kicked you out.
Wow. So
So
pressure.
it was, and I went there with three kids. My youngest was a year at the time. So, yeah.
Oh my
So I'm very,
goodness.
very, very dedicated to what I do, to what I learn, to what I provide to my patients. So, super excited to provide what I offer again because I have such a diverse background. I have so many different things that I've done to prepare for what I'm doing. In fact, I even worked in real estate, commercial real estate, in fact, administration, colleges, prior to going back to school.
Wow. Wow.
So I
And
bring
so
a lot of different things and aspects to what I do here for our patients.
and it's great to have that those different aspects of going to physical therapy and so you know what your patients are going to get when you send them different places,
Yeah.
and to be able to give recommendations or have some kind of background knowledge of what's happening with the patient because that's so important.
It is. Those ancillary services are so important too. In fact, what I love about our networking group is because I am developing relationships with all of our networking partners so that I know where to send my patients when they're looking for something unique for the specific situation that's going on for them. Because everybody's individual. Not everybody does really well in physical therapy or chiropractic or whatever. I have this posture specialist. He is wonderful. And I feel like he gets my patients to the next level of of care. So he's just wonderful. So again, it's great to have all these different options for patients with all the people that I know and that I've partnered with for their healthcare.
Yeah, it's so nice because we have trauma, people that deal with trauma, counseling, nutrition, right?
Yeah.
Different therapies to decrease inflammation, like the Beamer technology, where Leela, we're
Yes.
talking to her about.
Yeah.
And you say, wow, if we're looking, and then that's what was amazing about talking to you, because most doctors and or PAs or people in the healthcare field, if I start talking about metabolic health or mitochondria, they look at you like, are you nuts? Like, what does that do with anything? You know what I mean? It's just like throw drugs on people.
Yeah, yeah.
And
Well,
so
and
when you and I talked, I was like, "Oh my gosh, we're talking in the same language here, and it's pretty amazing."
yeah, yeah. And there's a lot of us, just so you know, I have met a lot of people who have our philosophy about, the whole not taking the band-aid medicine approach, right? So, not just throwing
Root
drugs.
cause, root cause
Yeah,
medicine, right? Like, let's
right.
not just throw drugs at every symptom and see
Yeah.
in a month.
And see, it's like kind of like you're the guinea pig, like, let's see if this works. Oh no, that one didn't work. Let's try this one. So that approach just isn't really that effective.
Yeah, and what do you think about medicine from when you first went in there and being you were in the system for a while too, so you got to see that side of it.
Yeah, so medicine has changed completely. I mean, even if you think about medicine 200 years ago, 100 years ago, 1,000 years ago, even 50 years ago, 20 years ago, 10 years ago, think about all of the changes in those time periods, particularly the last 10 years. Just with the cost of healthcare in and of itself. The cost is so high. But yet the reimbursement is so low with insurances, so it's very difficult to, spend time with patients in that environment. So that's what I love about what we do. We just have a direct contract with our patients. That way we can really individualize their care, and provide, top-notch care and spend quality time. That's how we're able to figure out the root cause of the situation that's going on with our patients. And that way we can figure out the correct treatment, and avoiding the Band-Aid medicine and fast food medicine model. So,
Yeah, and that's what I was saying too, being in primary care in the system for 20 years. I saw, oh, we're getting reimbursed less. My own personal insurance and cost of business goes up and up and up with, having
yeah,
computerized and HIPAA, compliance and all these things that we have to do
yeah,
in medicine. And so I
yes,
just watched doctors around me burning out left and right, PAs
yeah,
burning out left and right because the patient loads were such a huge demand. And the most prized uh, skill that someone could have is being efficient,
yeah,
getting patients in and out. The faster you see patients, if
yeah,
you spend an hour with a patient, they're looking at you like, "What are you doing?" I'm like, "Well,
yeah,
this
yeah,
person's going to get diabetes if we don't intervene. They need help."
yeah, yeah, yeah. But you're not allowed to do that. But you know what? I still did that anyways, because it's ethically the right thing to do. Period.
Exactly, and that's what we did. And then as a price, you're away from your family more because you do all those callbacks and begging insurance companies to pay for stuff at the end of the day for
Yeah.
3 or 4 hours.
Yes, you
So
do.
you work through lunch because you put your sickest patient before lunch, and then you
Yeah.
realize, oh my gosh, I'm never going to get out until 9 o'clock tonight. Then I got to
Yes.
be back here at 5:30 tomorrow morning again. And you realize, oh man, it's not good for us as practitioners. If we're trying to get our patients healthy, it's not good for us to be stressed and tense and running around like crazy people all the time.
Yeah. No, I mean, the system that we have, unfortunately, it just isn't working well. So that's why what we're doing is we're revolutionizing healthcare back to what I call retro care. Back to what it used to be 15, 20 years ago when you had a relationship with your doctor, right? Where they knew you by name. They remembered all of your situations and your stories, and that's what I do with my patients. And I know them all. They come in, oh my gosh, I already know what's going on with them. I don't have to review their chart, because I already know their whole story. So that's what I love.
Yeah, and it makes this easier for us because we know you, we know our patient.
Yeah.
When you walk in, and the other thing is you're not going to get lost. At my old office, it would be 30 people in the waiting room. And it's like, oh,
Yeah.
your patient's been here for an hour. We didn't see him in the corner over there. Like here, it's like
Yeah.
we're seeing one patient at a time, so you don't have a huge
Yeah.
waiting room with little kids coughing on you all
Yeah.
day.
Yeah. I love what we do here. I mean, we're providing such great care for our patients that, we're preventing hospitalizations. We're preventing, you know, um, chronic diseases from happening when we're catching things early. And that's, to me, it's all about prevention, good quality care, good education. And I'm excited, when we, finally can do our educational seminar that I'm trying to do with you, Leela, and I have a whole bunch of other people.
There's so many great people. I'm shocked coming from San Diego, being in a
Yeah.
smaller community. It's like, oh my
Isn't
gosh,
that
there's so many
amazing?
people who really want to help people, and they really have different
Yeah.
modalities that we can do that and say, oh,
Yeah.
I don't have to be the coach all the time. I mean,
Yeah.
sometimes it's because we're a limited resource. So to surround us with people who are like you're saying, our job is to be the best uh, coach and to know the best people to go to when you need to,
Yes.
right? But a
Yes.
lot of the stuff we do on our own just because of when I remember when I just got out of residency, I went to this talk and this old guy with gray hair like mine was sitting there and he says, you know what? 90% of what you tweet is lifestyle related. And I
Yeah.
was thinking, this guy's nuts. I mean, that there's no way. Now that I'm around, I was like, he's right. Because even a pulled
Yeah.
muscle is lifestyle. If you're playing pickleball and sprain your ankle,
Yeah.
but if you're sitting on the couch and you're not exercising, you're stressed and you're depressed and you get back pain and you're going through a divorce and all these things happen, and we can't just throw
Yeah.
drugs at all that when there's a root cause of what life isn't working for you
Yeah.
right now.
Yeah. Yeah. And that's what I love. I have several health coaches that I love, and I feel like they're an awesome part of our, team. Although they're not like personally employed by me, I refer our patients to them, so they're an extension of our team, I guess I should say. But I have several that I really love and enjoy. I have a physical therapist who's kind of a concierge therapist that I love. I mean, I just have so many different people that, and of course, it's just like with counselors or even with doctors, not every person is the right fit for each doctor or each, and that's what
Hmm.
I get to, that's why it's so great when I get to know my patients very well. I know who's going to be a good fit for them in general. And
Yeah,
so,
you know their personality, what they're going to
yeah,
put up with, what they're not, right?
yeah,
And
yeah.
so it's nice too, because some of the really good people say they give you a reasonable cash pay rate rather than going through the insurance. And so one thing we could talk about that I think is helpful with the Affordable Care Act and some of the newer health plans, like you were telling me, you have a $16,000 deductible, right? And if you're trying to make
Yeah,
ends meet and all of a sudden you get a bill for $16,000 before they pay a dime,
yeah, yeah.
it's a tough fit.
Yeah. And so that's what I love about direct primary care because it's just a very low rate for unlimited primary care. How can you beat that? It's like, I don't know, 1,000% off or something. What is 16,000? I mean, our lowest, so we have different plans, but our lowest is like $900 a year, depending upon what you're looking for and your age and things like that. So what is the percentage off $16,000 versus 900? It's just, there's no,
And having personalized care, you're getting better care,
yeah,
right? And like you
saving
called,
a
you need
lot
to,
of money.
and you're saving a lot of. I mean, it's a no-brainer, and that's why when I first started
Yeah,
looking at this model, I thought it's a
yeah,
no-brainer, really, because us
yeah,
primary care people aren't the ones making millions of dollars a year. Like we're just
yeah,
trying to help people, really. And
yeah,
so when you say, okay, if I'm paying $100 a month and I have no copays, because people don't realize there's huge copays for a lot of these
yeah.
plans, and
And
I just
deductibles. You have to
and
meet your
deductibles,
deductible.
and if you have a huge, this is the thing I want people listening to understand. If you have a high, and this is what I was arguing in my old practice before I left the big system, I said, gosh, there's so many people with these Affordable Care Act and they have a $10,000 deductible. When they come to see you, you're charging them the same rate that you're charging the insurance company, but the insurance company is only paying you pennies on that. So if you
Yeah,
charge the patient a reasonable cash pay rate and they could come in, and so they're not, you know, paying $500 each visit or $300. Some
yeah,
doctors, they don't realize that concept
yeah,
of
yeah,
saying, look, you're not getting reimbursed as much as you think you are when you start looking
yeah.
at the numbers, what Blue Cross PPO is paying you to do a physical, for instance, right? So charge the patient a reasonable amount that's not going to bankrupt them, and then they can get good health care.
Yeah, yeah. I mean, there's just so many solutions to the problem that we have here, and we're just one of them, right? It would be really interesting. I've been thinking about what if we had a concierge hospital? How amazing would that be? I mean, I know they have
You
them
know,
down in South America, but I mean, wouldn't that be amazing?
I know in
Have-
Texas, there's people talking about that. Someone was recruiting
Yeah,
me to do that because
yeah, that's
I just don't want to work in
awesome.
the hospital anymore. I'm an
No,
outpatient
yeah,
doctor. But you're
right.
right, like having orthopedic surgeon or who does cash
Yeah,
pay, and you build a network like that, because if
yes,
you're a physical therapist and you're getting reimbursed nothing from
yeah,
the insurance
yeah.
company, you go, okay, let me charge this patient a reasonable amount and I'm still doing better and I don't have to deal with all the hassles and paperwork and billing.
Yeah. It's just a matter of like good quality care, for a reasonable price. I mean, what is it? What do they charge for at the hospital for Tylenol now? So like
It's
30 bucks a Tylenol pill or
someone was
something.
just I was just talking to our medical assistant. I go, how much is it to like get an IV? And she's like, it's like nothing. I mean, it's not expensive at all to do. But in the
Yeah.
hospital, they charge you $150 for an IV, right?
Yeah,
Because
yeah.
you're stuck. What are you gonna do? And you can't negotiate. You're just
Mhm.
like, and then afterwards you got to figure that out. So there's I've been looking at some of these health plans that if you do end up in the hospital, they'll negotiate a lower price for you. As
Yeah.
a personal example, my oldest, who's a preschool teacher, she had a health problem. I was out of town,
Mhm.
so I wasn't available to help her. And she went to the ER and it cost, she was there for 3 hours, got an ultrasound of her liver to make sure she didn't have gallstones, and $11,000 bill. Her copay was $4,000.
You see, that's what I'm talking about.
Like, what could we do outpatient? Go, how much is an ultra? I can send people for at least in San Diego. I don't know the pricing here yet, but
Yeah, yeah.
it's like $40 for an ultrasound. X-ray is $12. It's
Yeah,
not like
yeah.
an
Yeah, yeah.
MRI. If you need MRI of your hip or knee, you can go in the same day and pay cash. Like,
Yeah, yeah.
I don't know how much it is here, but $400.
I can tell you,
Yeah,
if
you'll
you
know better
pay
than me here, right?
if you
Yeah.
pay cash, it's very inexpensive. And, if she was seeing our direct primary care, we would just order it right away, stat. She could probably do it the same day, next day. at Simon Med, and they give you the report basically the same day, next day. So, I mean, I don't know. It's the gallbladder is a hard thing,
Yeah, because you don't
Sometimes
know if you need
it's
surgery. Yeah, sometimes
yeah,
it's an emergency and you got to go in, and that's
yeah,
where our instinct comes in and our experience.
yeah,
And no, this is an emergency, or yeah, you better go get
yeah,
this checked. Might
yeah.
be appendicitis. Sounds like it. You have all the symptoms, right? Let's not wait a week. See,
That's why that physical exam is the most important. I mean, telehealth is amazing, but I do bring my patients in when they're telling me something interesting that I need to put my hands on. And I tell you, more often than not, the minute I put my hands on a patient, I'm like, this is something serious. This is not a telehealth thing. I'm glad you came in. I'll send them to I had one of my patients, she came in, oh, I'm having diarrhea. Okay. I did an exam on her. She was tender in the right lower quadrant, but she's an elderly patient. She ended up having a obstruction. So, and her symptom was diarrhea.
yeah. So things like that.
So
Yeah,
if
things
I
like
didn't
that.
put
And
my
she's probably
hands on
stoic. Yeah.
her, if
Mhm,
yeah, she's stoic, right? She's very,
mhm.
I mean, elderly patients tend to be, right? If I hadn't put my hands on her and felt her extreme tenderness, just touching that one spot, um, and I hadn't sent her to the ER, So that physical exam is one of my most important things I rely on for my patient care. But I mean,
And like you're saying, knowing your patient too, because if you
yeah,
know Tom never complains and Tom is in severe pain, you go,
yes,
oh, this is not normal for Tom. We
right.
gotta Tom, come in. Let's look at you, right?
Yeah, because everybody's pain level is different. They experience pain very different. The ones that I worry about are the ones that never complain. And then all of a sudden they're complaining, even with a mild problem. I'm thinking, oh my gosh, this is serious.
Yeah, you're coming in. Yeah, we're gonna make sure on you. Yeah, and that's
And
the
it tends to
benefit
be, yeah,
of
it
that and
always
knowing your
tends to be.
patients, right? It's so
Yeah.
critical because I know people in San Diego, 60% of my patients there go to a major HMO, but they said they're not helping me with anything. So they come to
Yeah.
me and pay extra to see me on
Good.
top of it because they said, look, they're not helping me. Now I have diabetes. They've been watching me for 10 years
Yeah.
get diabetes and no one they just gave me one
Yeah.
option of what I could do. I can go get a gastric bypass surgery or be on a liquid diet, which I don't want to do and I don't like it.
Yeah.
So it's hard because you watch them progress into like, oh, if we would have looked for certain labs, we could have prevented this from
Yeah.
happening in the first place.
Yeah, that's like Hashimoto's. Why do we only test TSH? Why don't we test the antibodies? Okay, we know your thyroid is getting damaged by your own immune system. Well, why don't we do something to support your immune system so that your thyroid doesn't get destroyed?
Yeah, and you're
No.
looking at gut health too, and that's a critical
Yeah.
thing that I mean, it's amazing.
Yeah.
Gastroenterologists don't even that I've seen people have huge multi-million-dollar workup, and no one says, "Hey, we should look at your gut microbiome. See, let's look at your
Yeah.
gut lining and see if it's okay."
Yeah. Yes, you've got to work on the inflammation in that gut and get those gaps fixed. Then you work on the microbiome and you help the immune system. You can really prevent Hashimoto's and all of those autoimmune disorders by helping and supporting the gut, and so exactly. So it's very important. So that's one of the things we really help patients with is supporting their gut health, which helps their immune systems, which helps their inflammation, which helps their all their joint pain, their brain cognition, all of those things. They're all related to the gut.
And you also do hormone replacement
We
therapy,
do.
right?
Yeah,
And so
which
that's a
also
huge
is
thing. And I
yeah.
never really appreciated that. I'm embarrassed to say I never really appreciated it till the last few years. And then
Yeah.
I had the pleasure of taking over and helping some people in San Diego. And I have a PA there who is a specialist in this area and
Yeah.
metabolic health. And so seeing women's life, in particular, women's lives change, like from being miserable, laying on the couch, miserable, and
Yeah.
just getting it right for them. And then they
Yeah.
like their mood, cravings, everything starts getting better.
Yeah, yeah. They thin down their mood, their cognition, bone health. That's the biggest thing. Osteoporosis is a huge thing, and a lot of those medications that we have. I mean, the side effects. People are afraid of them, so it's all about prevention. Looking
It's
deeply at the gut actually is one of the main root causes for a problem with osteoporosis. If you have pancreatic insufficiency, which your pancreas is not producing enough enzymes, if you do not have enough lipase, which is the enzyme that breaks down the fat molecule, you're going to have a bone problem. Why? Because vitamin K, vitamin D, they're fat soluble. If you cannot break down those globules of oil in a small enough fashion for your intestines to absorb it, or if you just have GI problems in general, you're going to get osteoporosis. It's a gut health problem, and it's related. It's not always that. I mean, obviously there's other things that, but that's a big thing that nobody looks at.
Or
Um,
along those lines too, people with chronic acid reflux, they'll be on a proton pump inhibitor for
yes.
30, 40 years. It's never even approved for that.
Yeah. Yeah.
And we
Yeah.
have people that are on it lifetime, and then they're getting hip fractures, and
Yeah.
their gut microbiome's a disaster because their
Yeah.
stomach doesn't acidify the way it should. And
Yes.
yeah, sometimes you just do a quick test. I don't know if you do GI maps and things like
Yeah.
that to
Yeah.
look. Yeah, so it's helpful because you go, oh my gosh, now we know what the problem is. Now
Yeah. Yeah.
these panic attacks, if we fix this gut lining, maybe this anxiety, panic attack, insomnia gets better.
Yeah. And it does typically because you have your vagus nerve. And the vagus nerve is a very crazy nerve. It controls your heart and your digestion. And it just is such an interesting, communication between the brain and the gut. And so
It
you
is
got to
yeah, it's
support that
shocking.
nerve. And if you don't support that nerve, you're also going to have bad gut health. So that's something I think gets overlooked as well. So,
There's a study. I have to pull up the study because a friend of mine I just interviewed him probably about a month ago, and it should be coming out pretty soon. But he was showing, we were talking about studies where if they cut the vagal nerve or block the transmission, Parkinson's, dementia, all these things were getting better when they blocked this. When someone had a really bad gut, you're like, wow, that just sounds
yeah.
like unreal. I mean, some of these things
Part,
are just like how it all works.
yeah, Parkinson's is, well, there's several studies where some studies say it starts in the brain, other studies say it starts in the gut. And depending upon how the patient presents for Parkinson's, I could understand both viewpoints. But the gut theory is that generally it's a GI, virus that or some type of bacterial infection that is the start of Parkinson's, and it somehow travels up through the vagus nerve, and that's how it ends up being in the brain. But it takes about 20 years, believe it or not, from the time that the infection occurs till till the shakes start, basically. So it's very interesting, the studies that I've read on gut health and Parkinson's disease and all of those other things related to the vagus nerve. So I think one of the biggest things that we have to do in medicine is make sure that we're supporting the vagus nerve, that we're always keeping that in mind, that we're not neglecting the vagus nerve. It's such an interesting kind of wild nerve, I call it.
And so we're both in this little town in Arizona, Prescott, right? And you say, wow, I've been in the big city for a long time in San Diego, and no one talks about this. Like no one there that I knew understood any of this stuff. So
Yeah.
it's interesting when you get out of the shuffle, maybe it's because people are so busy they don't have time to even think about it. I know in my career I was so busy at one point I was like, I'm not going
Yeah.
to listen to what Dr. Oz said. I'm not listening to that. It's all crazy. Like they're all fads that go by and they go away, right?
Yeah.
And so it's hard to say what is real and but the thing is with experience, you start saying, if we do this, if we get less stress and we're sleeping better and we're eating right, then all these other things start taking care of themselves.
Yeah. Well, think about, people in the 60s and 70s. The food source is also a big problem, right? We keep planting on the same plot of land. How do our vegetables and fruit get their nutrients? From the soil, right? We know
Mhm.
that fruits and vegetables absorb nutrients through the soil. So if you deplete the soil 20, 30 years ago, how in the world are those fruits and vegetables? I mean, you can only do so much with, fake fertilizers, right? So, even with the organic food places, I mean, they still keep replotting on the same plot of land. So, I think that is a big problem. I mean, do you remember when we were kids and you ate a piece of fruit like a strawberry and it tasted amazing? You go to the store, even organic, it doesn't
Mhm.
taste the same as when you were a kid, right? Am I wrong?
Yeah, no, that's true too. And also, from my experience of, cutting out processed food and sugars, I don't eat like, the sweet desserts. So I have a
Yeah.
strawberry, it tastes sweeter to me than everyone else tastes it doesn't taste sweet because
Yeah.
your taste buds get so overwhelmed by these super sweet stuff,
Yes,
and you're not even,
absolutely.
you don't appreciate it anymore. But you're right. Cause when I go out for my bike rides here and I'm looking at all these cows just grazing in their grass and happy out there. I'm like, man, this is the way it
Mhm.
should be.
It should be.
These big
Yeah.
ranches we have around us and everything.
Local food is important. That's what I know. And changing the plots of land is important. So, and we need to focus on our food supply. I think that's really important. Avoiding pesticides and fungicides. Those things are harmful. They don't help us. And that's what I was going to say. Think about the people in the 60s and 70s. Look at the pictures of people from the 60s and 70s.
It's
Nobody
crazy.
was overweight.
Yeah.
Nobody was like had these chronic diseases. It just wasn't a thing. Now, what happened between 60s and 70s and now? The food supply changed. That's
hmm
it. It really did. We outsmarted ourselves with all these chemicals and keep replotting the lands, commercializing food
And
production.
shelf life or food could be there for a year and you eat it a year
Yeah.
later and it's just sitting there.
Preservatives and
Yeah, it's
additives.
amazing, and we got away from that. Now, when you talk about that, they think you're from another planet, but
Yeah.
you don't realize. I think when you go to the store, I think they say 85% of the what they call food, and I heard someone say is processed foods, and you say, well, if all the food is good, how come they have to have a health food section in the store? And they go, this is health food. Like, what's that? What's the rest of it in the store?
Well, it's funny because I only buy, when I go to the grocery store, I basically go to the vegetable fruit section, the eggs, milk, cheese section, and the meat section. And the rest of the store I completely ignore. I walk through there and I look and it's just boxes. And I'm like, I'm not eating a box. I'm sorry, that doesn't look delicious to me.
And it's not
So,
healthy, and you look at that and you see all the food colorings and all this stuff. I mean, it's shocking how many.
but
Uh,
most of the store is boxes. It's like the entire store is boxes and it's
And that's
empty.
what people are in their mind they believe. And going through COVID and the lockdowns, I watch people like crazy just going back to their childhood, cereal that they had on Saturday morning cartoons because
Yeah.
that they will remember the good old days. And then they
Yeah.
got diabetes and sick. And you go, oh my gosh, this is not the way because you couldn't exercise, you couldn't go outside.
Yeah.
Like
That was so bad.
everything we're saying is the opposite. Saying get out in the sun,
Go
get
touch grass. That's what
yeah,
I
touch
say.
the grass, go work in the garden, get
Yeah.
some, get your hands dirty, go and enjoy life a little bit, get those good microbes in your gut. So yeah, it's amazing. And then, in Western medicine, we're very quick to throw, I just saw a patient, she's new to me, and she said she's been on like 22 different antibiotics in the last 5 years. You go, oh my gosh, like that is.
Why?
And why? I was like, did they get a urinalysis on you at least or anything? No, they just said, here, take this antibiotic. Oh, that's not working. Here, take this one. That's not working. Take this one. It was like, oh my goodness. Like,
I had a patient like that right when I got out of school. I was working in the mountains of California, and I literally started that job 2 weeks, from after, that was my first job out of school. She came in for just a mammo order. And so, I didn't really review her chart in depth, but I walk in there and she looks terrible. And I'm like, what's going on with you? She's like, oh, I keep having these UTIs. So I said, okay, just a minute, wait a second. So I went back to my desk. I really researched in her chart. I saw she had a history of diverticulosis. And then at the very moment that I saw that diagnosis, my medical assistant, who's very astute and I enjoyed working with her very much, she's like, Tammy, you need to come and see her urine. I walk in, I look at her urine. There's floaties in there. I immediately knew she had a fistula. Immediately. And she did. And I saved her life. But in the meantime, she had seen our medical director, and the other doctor that worked there all the time, who was seeing her all the time, another PA. They just kept giving her band-aids of antibiotics. I was the only one who was there just to do a breast exam. Who's like, why is this a
yeah, it
situation?
doesn't make sense. And that's the thing is we have to have this like, that doesn't make sense. And so
Yeah.
there's very few, and that's what I've noticed about medicine in particular is like people have lost we have guidelines now. They go, okay, this, and this. They have diabetes, you give them this medicine, then this medicine, and when that doesn't
Right.
work, you give this medicine. It's like, wait a minute. Should we think of like why are your sugars high?
Yeah,
Because
yeah.
you're eating a lot of sugar and I'm giving you medicine to make you pee out more sugar that's causing your
Yeah.
urinary infection. Why don't we just not eat more
Yeah.
sugar and then we don't have to pee out more sugar? Can we
Yeah,
do that?
yeah.
And people say, yeah, sure, I'll do that. Okay,
Yeah.
great.
Exactly, and so you just have to think out of the box. And I guess I've always wanted to I considered being a detective back in the day. So
That's part of this for sure, right?
maybe that's what it is, why I just know things about people. Like, unfortunately, I walk around town and I'm like, okay, I know that person has sleep apnea, that person has diabetes. It's just a thing that I do, and I don't mean to do it. It's just I
When
just
they can't
don't.
help it, like when it's I think our job is kind of like being a mechanic too, right? And so
Yes.
as a mechanic, you look and go, okay, you're having this doesn't fit with this problem, and so
Yeah.
many times people are misdiagnosed because they're not saying this doesn't fit, like that part of
Yeah.
your brain shouldn't be affecting this part of your body. It doesn't make sense, right?
That's why I
So,
love the holistic approach
mhm.
because it's not a compartmentalized approach. It's not like this is just a neurological thing, this is just a heart thing, this is just a stomach thing. It's not that. Those all are affected by each other and they all, you know, they're just connected. That's why I love the holistic approach that we take here at Grace, and I'm sure you do the same. So, um,
Yeah, I think that is the ego. Why is it? It's not normal to have high blood pressure. Why do you have high blood pressure? Let's look at it. Are you stressed, tense, not sleeping? Are you drinking every night? Are you smoking? Are you fighting with everyone at work all day? And so all these things
or
we
is
can
it
look
your
at.
renal artery? And
Yeah, or is
that's
it
what I
renal artery
found.
stenosis? Yeah, yeah.
Yeah.
Could it be that, or could it be your
Yeah.
insulin super high? And 90% of
Yeah.
the time, I see high insulin level with a high blood pressure. And so you go, let's not just throw drugs and stuff. Let's try to figure out why you're having that.
Yeah, because then you can figure out the correct treatment, you know? Of course, we always have all those medications if we need them, which is wonderful. That's what I love about what we do because we have all of those medications. But if we can avoid a medication, right? Because you start down the medication rabbit hole. You take one medication and then you have like terrible side effects, and you need three more medications for the side effects of that one medication. I've seen that so many times. So it's great to have all the medicines that we have, and I'm very, very thankful we have them. But if we know the cause of your high blood pressure and your kidney disease is simply a renal artery stenosis, we can fix that.
Yeah. We just have to look and think like that
Yeah.
fistula. You need someone to think and go, you're on all these antibiotics for no reason. And right. And it's amazing. And it's how many times it's just no one really looked. They go, oh, she keeps getting urinary. They don't even look. They just say, oh, urinary. Oh, you had another one. Here you go. Here's some
Yeah.
more antibiotics. And
Yeah.
so I was actually part of a study that was the first paper of deprescribing medications. Like it
Uh-huh.
had never been done.
Oh,
There's no
wow.
studies on how do you properly deprescribe proton pump inhibitors, insulin, like coming off insulin.
Yeah. Yeah. Yeah.
When I first started doing low carb or metabolic health stuff, I had 11 people come off insulin in 6 months. I had never seen that before. And I
Awesome.
always heard these things about naturopaths saying like, oh, they're crazy. You're going to die if you're never coming off insulin. Now it's like, yeah, you can. It's not in the ADA until recently said this is a chronic progressive disease. No, it's
Yeah.
not. It's
It
not.
doesn't
If you
have to
treat it right,
be.
it's not.
It doesn't
Right.
have to be. Yeah. So I send all my patients who are, in that category to you. So,
Yeah, and I don't want to mess with hormones. I'm like, I'll send them to you. So that's what's great is that we can work together and say what's best for the patient. Who's the best person for this patient?
yeah,
So
yeah.
some of the guys may not want you checking their prostate, and the women are not saying, I don't want this old guy doing my gynecologic stuff. So
Yeah.
it's actually really a nice thing and then having this relationship where we can reach out to people. Have you ever seen this before? This
Mm.
is kind of weird. How do
Yeah,
I
yeah.
manage this? And we learn from each other, and that's how
Yeah.
medicine gets better. And we've gotten
Yes.
to the point in medicine where I personally go to a chiropractor, right? If I hurt my knee,
Nice.
I'm going to physical therapy. And
Yeah.
so many doctors like, no, they're quacks. Don't go see them. It's like there's so many good people out there. It's like open your mind. You're
Yeah.
not helping the patient.
Yeah, yeah, yeah. There's so many great options for patients, and it's just a matter of education, and showing them, what other options there are, to optimize their health. And it depends on the patient. Some patients are great candidates for chiro, some are great candidates for physical therapy. I love my posture specialist, Alex Simmons. He is an Egoscue specialist, which is a
I'm writing
really
that down.
amazing.
Alex, I'm going to track you down, man.
Alex Simmons, you should do a podcast with him. He is amazing. So,
Awesome. Yeah.
yeah, yeah. So
Well,
I
you
really,
connect us. Yeah, because these kind of things that you say,
yeah.
well, if you get your posture right, I'm telling you, if you're
Yes.
sitting at, I had a patient of mine, an attorney, and he said, Brian, both my hands are going numb all the time. And I'm like, really? He goes, yeah, all the time. Like at the end of the day, I'm shaking my hands there now. I said, that's weird. Have you injured yourself? We go through everything. No. Well, I think it's probably like spinal stenosis in your neck is the only thing that makes sense. And you don't have carpal tunnel. We checked him for all that stuff.
Yeah, yeah, yeah.
So I said, let's just get an MRI and just make sure everything's
Yeah.
okay. And the next time I saw him, I said, hey, what's happening with your hands? You didn't get your MRI. He said, I don't want to tell you. I said, why? He said, I was working on this big case, and my partner, who's my patient too, walked by, and he walked by on the outside of his office door, and he stopped back and he said, what's wrong with you? Why are you sitting like that? And he said, what are you talking about? He said, you're like all hunched over, like what's wrong with you? And he goes, go to the eye doctor, who's a friend of mine, get your eyes checked. He said, I got new glasses. my hands don't go numb anymore,
Oh,
right?
wow.
So
Because he
how
was
much
looking
positional? It was just
right.
all positional
Wow.
sitting like that. Or if you
Yeah.
walk around stressed and tense and angry all the time, and
Yeah.
it's
Yeah.
not good for your jaw and TMJ and all that kind of stuff.
No, no, no. Yes, posture is the number one thing. I think, as far as for pain management, I think you've got to really, again, the root cause is posture. And so I try to help my patients with different modalities, right? I love physical therapy. Like I said, I did a lot of work in that field in the past. So it's sort of a passion of mine. But the Egoscue therapy is a little bit of a different approach. It's kind of this sequential exercise routine that he does. And I feel like it just gets the patient to like, what am I trying to say? Physical therapy can get you like 80% better. And then the Egoscue gets you that next 20% that you're looking for. That's how I look at Egoscue. So,
Yeah, and
um,
that's so great when you know the specialist, you know who's good. And then if someone's a jerk to our patient, we're gonna say, don't, we're not going there anymore. We're gonna go to where people are treated nice, right? And
yeah,
they're
yeah,
getting
yeah.
better. So that's what's amazing about getting to know a community,
Yeah.
and who can help the patient.
Yes, and I love our power team. Did you get a chance to look at Larry's dream team? Did you do that
Yeah,
session? Isn't that
yeah, I did.
amazing? I
It's
love.
amazing. And I think
Yeah.
that's what's so great. Is like, okay, how do we support each other? Like I've used a
Mm,
lot of people. What we're talking about is a small group, social networking partners. I never had to network before. I never did this in my
yeah,
life
yeah,
because in
yeah,
San Diego, I was busy from day one. So I never had
yeah,
to like
yeah,
get
yeah,
known and know who's good in the community. But here, like, how do I know who's the good orthopedic surgeon unless I talk to you and say, who do you use? Who do you like? Right?
yeah, yeah.
Who's the best, whatever.
We
And
have
so
quite a lot of good specialists here. Most of the cardiologists are amazing here. So, um, I've heard different things here and there, but
of course, like personalities and all that. And I've
yeah,
seen it. And I was like, wow, when I first like my first patient here that I saw, she said, "Oh my gosh, I'm so happy because you're addressing all my stuff at one visit." I said, "Yeah, of course." What? She said, "I went to urgent care and I had a urinary infection and I happened to hurt my knee that day." And they said, "Which one do you want us to look at?" She goes, "I waited 3 hours to be seen."
isn't
And they
that
told me I could talk
ridiculous?
about one problem. I was like, how long does it take to get a urine dip on like really? They go, "Yeah, you can come back tomorrow for the other one." It's like, wow,
It's
that's
so
crazy.
true. It's so true. And we don't really have urgent care here. We have like one urgent care. Well, I think there's maybe two now, but a while back we only had one urgent care. And if you didn't like call in the beginning of the day, they actually just schedule you. So if their schedule's already full, then you can't get in to be seen. So I needed a suture on my right hand. I can't suture my own my own
Yeah.
hand. I'm right-handed. I needed a suture. Well, they couldn't see me. Can you believe that?
Yeah, and you're bleeding. You're like, what? Okay, I just bleed here. I have to go to the ER and pay,
Yeah,
$10,000 to get that same thing done. Yeah,
exactly. And that's what's
it's
great about a place like what I have, because we can get you in same day, next day for a suture. You can avoid all this like re- whatever, this urgent care, which isn't really an urgent care visit, because you already have somebody who can help you with your
and
urgent
they
care.
don't know you, and you know them, and that's the benefit. That's what you know in San Diego right now. Yeah, if I want to get someone into an oncologist, at
No.
least 3 months wait.
Oh,
Cardiologist, 4 months.
oh,
Neurologist, five
a
or six
long
months.
time. Yeah.
Like, how am
Yeah.
I going
Yeah.
to take care of that patient? It's like, so I have to call these guys and go, come on, man. You got to have
Yeah.
someone. So when you have a relationship, they'll go, okay, Brian, tomorrow at lunchtime, I'll see him. Okay, thanks,
Yeah.
man. Appreciate it.
Yeah.
Right.
Yeah. Yeah.
And so it's hard. And that's what part of it is. And the other thing that we could talk about too, that I think is important is we've lost our patient advocates and physicians because they're so beat down. They're not going to, you go online and like it's a nightmare, like trying to get something like an MRI approved, and they go, okay, you got to wait, you got to talk to this person, then you go, oh, you got to talk to this person, oh, you got cut off, you have to call back, and then you go through the same thing over again. You go, if I had to do that with 50 patients, and forget it, I'll lose
Yeah.
my
Yeah.
mind.
Yeah. Yeah. Our system just needs to be revamped. It's not working. It's not
Do you
working for
think direct
patients.
primary care is the way it has to go?
I don't see another way. I mean, what do you think? I
Yeah, I
just
don't
don't
see
see
another
another.
way because here's the deal, and anyone listening, I want you to hear this because you have to understand the incentives in medicine.
Yeah.
When I resigned from the
Correct.
HMO practice, the head guy who was a friend of mine, I said, he goes, I can't. Are you having a midlife crisis? Why are you leaving? I know how much money you made last year. I said, look, I can't take it anymore because I'm working 18-hour days because I want to help my patient. So I worked through
Yeah.
lunch, and I said, look, I have Like at that time, I had 11 people that came off insulin in 6 months. And I said, I have about 50 people I can guarantee you would have gotten diabetes. That's your number one cost. I know what you're paying for.
Yeah.
Diabetes, number one cause of cardiovascular disease, number one cause of blindness, number one cause of dialysis, number one cause of amputation, non-healing wounds, you name it. Diabetes is the disaster. So if I can prevent it, I'm saving you money.
Yeah. Yeah.
And he looked at me and said, no, Brian, you're costing us money. And I said,
Yep.
how can that be? Because if they don't get the diagnosis, we don't get paid by the federal government for that diagnosis code. The more codes you make, the more we get paid.
Yeah. It's the sick care system.
It's incredible.
It is designed to keep people sick.
And then I asked him, am I the one going through a crisis or you? Like, seriously? You think that's what you want to do? Is that why you went to medical school?
Yeah.
Like, we're supposed to make paid. Like, you and I say, okay, the healthier Tom is, the less frequently I'm going to have to see him. And I can see other people who are really sick.
Yeah.
Right. And when Tom gets sick, I'll be there for him when he needs it. But, it's really like AAA. It's like they're there when you need them. And if we're not, you fire us and go on to someone else.
Yeah. Yeah.
Right. That's the model.
It's wrong. It's wrong. And I refuse to. If I can't do this, I'm not working in medicine. That's it. That's my choice. This is the only way I'm doing medicine anymore. I can't work in that system anymore. It doesn't work for patients. It doesn't work for me. It doesn't even really work for the system. It doesn't work for health care. If you're incentivized to keep people sick, what is that?
It's insane. It's insane because I'm your advocate, and if you get sick, oh, by the way, I make more money if you get sick. It's like in our case, I make really, if you get sick all the time, I make less money because I can't see as many people because I got to take care of you all the time. So my interest is like, let's get you healthy. Let's fix this knee that you got. I can't see you every week for this. We got to fix it. Let's see what modality will work for you. And that's why you don't want to see us all the time, right? You got better things to do. Go hiking. Go ride your bike. Go collect rocks, whatever it is,
So how our model works is we're incentivized to keep you as healthy as possible. Yes, that's what I love about what we do. Plus, it's ethically correct.
That's why we went to school. That's why we went to our education. You want to help people, not say, oh, how many people can I see in a day? What's the record? As I was just reading something this morning, it was the same thing. They were saying these doctors were incentivized by whoever saw the most patients in a day was getting rewarded. They were getting a bonus, like whoever sees the most. So they had a contest to see who could see the most patients in a month period. You go, well, how good is that for the patient? Like, do you want if someone's gonna make you a shirt, you want to make 1 or 2 shirts a day, or do you want to make 3,000 shirts a day? How nice is your shirt going to be at the end of the day? No one could work that fast, and then call you back on your labs and not miss something and not be so fatigued and stressed that they're going to miss stuff, right? Cognitive and doctors.
Yes.
Burnout.
Exactly. It doesn't work. It just doesn't work. That whole model of incentivizing doctors to see more patients and give them less care, it doesn't work for me and my heart, period. I just can't do that.
Was it stressful for you jumping out of the system and then starting Grace Direct Primary Care? Was it like,
no, it was,
you knew it was going to be fine, right? You go, I don't need to make a ton of money right now. I can ease into this.
I have loved every single second of it.
It's funny. It's funny. I mean, I do too. I love going to work. I love spending time, with my patients and having, it's like, that's what my wife even says. That she was just interviewed on a podcast, and it was really amazing to listen to it because she was talking about the difference of me, stress wise, life wise, before and after. And it's night and day. My neighbors at my old house would tease me. They said, Brian, why do you even wash your car? And I said, what do you mean? They go, we never see you in the day. You're leaving the dark. You come back in the dark. You might as well not wash your car. I was like, wow, you're right. That's my life, isn't it?
That's
terrible. You don't realize it because it's just a grind.
Yeah. Well, you're in it, and so you're not taking a step back, whereas your friend was for you, which is great, and when somebody says something like that to you, makes you think, like, what am I doing?
Well, having good friends is the thing. And another friend of mine said, hey, Brian, because he said, you know how long it's been since we had dinner together? And it was like over a year, and we're best friends. And I was like, that's crazy, isn't it? He goes, yeah. But he lived in Orange County. I was in San Diego, so it was a little drive. And he's a pastor, so he worked on the weekends when I was off. So I said, well, look at our lives are crazy. Look at that. And he said, hey, Brian, if you were your own patient, what would you tell yourself? And I was like, oh, man. Yeah, you're right. Yeah, you're right. You need to enjoy life. You need to have time to,
there's a
watch
balance.
the cows. Yeah, balance.
Right. There's a balance that has to happen. So one of the docs that I worked with, he was in Sacramento area. He was one of the concierge docs that I worked with that I loved working with. And he was the most balanced person. I mean, he was concierge, but he was the most balanced person. So I appreciated his mentorship, especially for that piece of what he taught me to have a balanced life. So I worked with some great docs, but he was probably my favorite mentor. So yeah.
Wow. Yeah, that's a huge thing, and for me, when I was in med school, I go you have to rotate it and you shadow doctors. And I go in with this old doc who's been around for a while. And I'm thinking, what is this guy doing? He's not doing anything. He went in and talked to, Sally for 20 minutes. And I'm like, what does he do? And he came out and he said, like, he didn't do anything. They were just talking about life and kids and all that. And he goes, oh, Brian, he goes, Sally's doing really well. He goes, last time I saw her, she couldn't carry on a conversation. So she's mentally, and he goes through this whole list of everything that, and wow, just by talking to her, he picked it all up, and he knew, oh, she's not depressed, she's doing this, and she's playing games again, she's going out with her girlfriends. Oh, this is fantastic, she's doing great. I was like,
Yeah.
oh my gosh, you are doing something after all, right?
And it's all about keen observation. And that is, I think, something that um, that I'm exceptional at. Not just the big picture. I get the big picture, but I also see like the fine details, like that example of the woman that I mentioned before. What I was supposed to do a breast exam on her, but I walk in there and she just looked not okay. Like,
Yeah.
if I didn't have my, my observation glasses on, my microscope glasses on, I probably just would have, like everybody else, okay, here's your mammo order, but no, I am a keen observer, and that is something that I think you have to be in the medical field. We're going to miss things,
Yeah, and if you're
and
in a hurry, you could be the best observer in the world. But if you have to observe 50 people in a day and you rush and you got a conference call at lunchtime and then you have a meeting with HR, after work, and you think, oh my God, you don't have time to, you're
yes,
thinking like, I got, as a matter of fact, my probably the biggest stress that I had in my whole job. And like, I appreciate every day. It used to be like, I'd be in there with a patient trying to explain something. And then all of a sudden it's like, knock on the door because I know I can help this person. And they're like, doctor, there's
yeah,
3 people waiting. I'm like, oh
I
my gosh.
know.
But this person needs
Yeah,
me right now. Well, give me a minute. Like you just squeeze 4 people
yeah,
into my schedule. I don't even
I
have a lunch break.
know.
Like, what am I going to do? So those kind of things. And then you realize, oh, I'm taking time from my family to take care of patients,
Yeah,
and so you sacrifice a lot. So a lot of these doctors are really burned out. They're not happy with what they're doing. As a matter of fact, crazy enough, when I was here, where this thing's behind me, I used to have a little couch there, and I'm like, that doesn't work in my office. So I sold it on Craigslist or whatever. And
uh-huh.
this guy comes in to get it. He's like, oh, you're a doc? Yeah. He goes, do you want a job? I'll hire you at the hospital right now. I'm like, you don't know me. I could be nuts. He's like, I don't care. We need people.
Yeah,
I
yeah.
was like, wow, that's scary. That's scary.
It is. I
Yeah.
mean, we just don't have enough doctors here. We don't have enough providers. We just don't have enough staff. Even just staff to help us as providers. We don't even have that here. And I think a lot of that has to do with the housing is very expensive here.
Hmm.
It's hard to find good quality people who can afford to live here, as far as staff members go, anyways. So,
Yeah, no, that's true. I think I've heard that too. And I know, just I talk to builders and they can't find people to work. Like they go, I have all
yeah,
these jobs, but I can't fulfill the contracts because I can't find people who want to work. So it's
yeah,
hard because of work ethics change. There's a lot that's changed. And
yes.
that's what I love in Prescott being around a lot of
Mhm.
seniors. Seniors have a different
I love
mindset.
it. They're my
You know what I
favorite.
mean?
They're my favorite generation. They really are. Um, I really like Generation Z as well, because those kiddos, they they were born during the recession, so they have a different mentality, a different perspective. They love
Yes,
the
true.
earth. They're hard. They're a little bit hard workers. They have their own kind of little quirky things, but I really love Generation Z as well. They're an
And
interesting
maybe not as
generation.
materialistic, maybe not
Oh,
as
zero. Well, they have some, but it's not like our
yeah.
millennials or, I mean, no offense to millennials. I love my millennials too, but
Yeah, we
my
don't want to offend any generations here, but
no,
but we do see a different.
comparatively.
My seniors always, I loved it. They would dress in their little outfit and they come in like they're going to church and it's like their thing, and the social part of it, and that's why again the lockdowns were so devastating because I saw people decline so quickly
Yeah, me
because
too.
they had no like if they lived in somewhere they couldn't see anyone, they had masks, they were no, like one of my favorite patients, she would like they would knock on her door and go, wait 10 seconds and then you can come out, get your food and go back in. So they would drop out the food and go away like they're in prison, right? And they never saw a person. She goes, I saw her in a Zoom meeting like this, and she started
Yeah.
crying. I was
Yeah.
like, "Why are you crying?" She goes, "You're the first face I've seen in 6 months." And I said, "I'd probably cry too if this is the only face you saw in 6 months." But she's like, "No, it's just good to see you smile and laugh." And even like,
Mm,
people would have speech problems, or if they had visual
autistic.
problems, and then they're
Mhm.
wearing
A
the
mask.
speech therapist is wearing a mask, and they have no idea what they're
Yes.
saying, and they can't hear them because they're hard of hearing. It's like, oh my god,
Yes.
so frustrating for everyone.
It was. It was so frustrating. And how long were those masks? 3 years or something? At least I was still, when I was working in neurology, we were still using masks. So that was like 2022 was the last time we stopped using masks. 2023, actually, I think, we were still requiring masks
And
in the
how long?
neurology office.
Yeah, yeah. And how long has Grace been around?
Since July.
Oh my
So,
gosh, so you're new. Oh, you're new
yeah.
doing. Oh my goodness, I
Yeah.
thought you were around for a while. So
Well,
I know you're around with
technically.
experience, obviously, but the practice itself, that's
Yeah,
amazing.
yeah. Well, we opened our doors in July. So, yeah.
Yeah.
Yeah, so we're
So we're
really
both
doing well.
newbies here in the area. That's
Yeah.
great.
Yeah,
And
we're
it's
doing
great.
really well. So, I'm surprised how much we've grown. But I
And it's
really
good.
shouldn't be surprised, but
You
I
shouldn't be, because, it's those things. People want good healthcare. In the community we live in, people have worked their butts off their entire life. They
yeah.
say, I want to get out of the rat race. I want to live somewhere where I can go on the lake and kayak and do whatever I want to do.
Yeah.
But healthcare is the downside. The healthcare is like not being able to
Yeah.
get into your doctor, and you have to wait forever. Like my
Yeah.
neighbors, they go, how long is it take me to see my new doctor? 3 months. I
Oh
can't
my
get in for
gosh.
3 months to see my new doctor. I'm like, well, once
Yeah.
you get hit by a car before that, will they see you? I don't know. Right?
I
It's
know.
kind
I
of
know.
scary.
Yeah, and not only that, I mean, most places aren't even taking new patients. So, I've heard that a lot too. And the ones that are, again, they're like really long wait lists. So, yeah, so
And they don't know you when you're seeing new people every time, and there's a flux, and it's so trust us, this is a better way to go, people. Look at
mm,
that. And so I'll let you defend direct primary care since I do it all the time. So I'm a Medicare patient. Why should I come to you? I have insurance. Why do I need to see you and pay you extra for this?
well, Medicare is wonderful. It does help with all of your general needs. So if you need an imaging study, you need medications, you need, depending upon what plan you have, you need ancillary studies or specialty referrals. Those are all great. However, in the current system that we have right now, when you use your Medicare, you're going to have to be a part of the system. So that means you have to wait to see your doctor who's accepting Medicare patients because they have a gazillion Medicare patients that they have to take care of with only smaller reimbursements. So they have to get you in and out quickly. So generally, you'll only be able to talk with your primary care doctor for one problem at a time. What if you have
In maybe
10,
10, 12 minutes, 15 minutes max.
5 minutes
5 minutes. Yeah, yeah. And they still got
for
to write
one
their note in
problem?
that five. So they have their back to you
Yeah.
type in their notes, right? I've seen that.
Yeah, yeah. So, and with direct primary care, what we offer is you're able to come in, we have a whole conversation, we see how you're doing, how your family's doing. We talk about all of your problems, we treat all of your problems, and we get you feeling better a lot quicker instead of, can you imagine you get to see your doctor for one problem and you probably only get to see them once a month? You only get to take care of 12 problems in a year. We do that in one visit. So, I don't know.
Yeah.
For
And we have time, and you're
for a
paying like,
very
yeah.
relatively inexpensive price. I mean, for Medicare patients, it's about $1,200 a year. Um,
Yeah, it's ridiculous. It really is. You look at like your Starbucks is costing more than that, really. And that's the thing is, we're not really good at marketing ourselves, getting out there. But you look at the numbers from just a numbers. It's a no-brainer from a
yeah,
numbers perspective. And you go, what quality of care am I going to get? And that is the thing. Because
yeah,
at my old office, it would take 4 or 5 people for me to get the message to refill someone's medicine. Right now,
yes,
they'll text me and go, hey, right now at 4:30, I just got some.
yep,
Can you fill this medicine? Yeah, no problem. Done.
yep,
Send it in electronically.
yep,
We're done. We could do telemedicine. We could see you same day, next day. And if you want to have your family come in with you, we could all sit and talk. It's no big deal. We have room for that because we're not jammed.
yeah.
And I think it's really that personal touch, because when I first went to these meetings, I'm like, everyone's like, oh my gosh, Tammy takes care of me. She calls, like, we were just in the meeting and someone's like, does your doctor call you with the lab? She called me right away with my lab results and then went through them with me. I was like, that's how it should be, right?
Yeah,
So
it should
people
be
think,
that
oh,
way.
they didn't call me, so it must be all right. No, it's not all right. You got to know,
Yeah.
like you have to get back to people, right?
Yeah, yeah. Yeah, I call my patients every day. As soon as they call, they get a call right back. In the regular system, you may not even get the message for days and days, depending on who got
Yeah.
the message.
And I'll
So,
tell you that as an example, just my friend said, call this office and listen to what they say. The office says, uh, look, we'll get back to you as soon as we can. If you keep calling, it will delay that. It will take longer for us to get back to you. It's like, well,
yes.
that tells me that you don't really get back to people because why should they have to keep calling? You shouldn't have to keep calling. Say, hey, you call us, we'll get back to you today. I'll get you
Yeah.
back to you in an hour. Like people today, I called someone right back and it's like, you're calling me right now already? I'm like, yeah, you called me, right? I had a break right now, right? I'm waiting for Tammy so we could do this podcast. So I got time.
Yeah,
Yeah.
yeah. Yeah, no, I mean, I have patients that call, they're like, hey, I need a refill. We send it right away. I have, and also the other thing that is so great about direct primary care, with our lack of specialists in the area, right? I have a whole kind of network of different specialists that I try to utilize. Um, and if they're not taking new patients, I call around to find somebody who can take new patients and who can get them in at a reasonable time. I call the specialty offices to let them know exactly what I'm seeing with my patients so that that way they can expedite their visit. So that's the other really great thing about concierge medicine is that we can coordinate specialty care, which is really important. I mean, I can't tell you how many times that has really saved a patient from ER visits and even death, honestly. So it's a thing. You know, we have to get patients into specialty. They can't wait a year, like unfortunately here in town, to see neurologists for significant serious issues. It's a year. Two of them aren't even taking patients because they're
Yeah. And
so booked up.
pulmonologists too. There's like
Yeah,
no
yeah, yeah.
problem. It's
Actually,
a
Doctor, so this is a great thing that just happened. So Dr. Leidinger, he was over with YRMC. He is now going to do telehealth. He has an NP who's going to be doing in-person visits like 2 days a week. They actually contacted me to rent out some of my space here.
oh
Um,
great. See,
yeah,
good.
and so I was willing to rent some of my space out because we need a pulmonologist. And luckily they and I, it wasn't, like I like my own space, but I was willing to do that so we can have somebody here in town. I have patients who need pulmonologists. Um, so I was willing to do that just so I can, make sure our patients are well taken care of in Yavapai County. Luckily, they found another location, so that was good. But he's going to stay here, so we're going to keep our pulmonologist here. So, and I was willing to help and keep him here because we need him. Pulmonology is a huge thing in our town, and we have people with serious diseases, and we cannot be a town without a pulmonologist. That is just cannot happen. So I was willing to do whatever it takes to make sure that our community has. But
Yeah,
yeah.
and that's the thing is you have this community and like I felt welcome right away. I know when I
Ah.
first joined, you're like, wait a minute, like we're both in the we're doing kind of the same thing. And so in our group, I don't talk about direct primary care at all, but it's really talking
Yeah,
about metabolic health and saying, okay,
yeah,
look, I'll work with a doctor. I do a lot of consults and I see people and I'll say, let me just get you on track. And then but here's what you need, blah, blah, blah. And I can even talk to you. I'll go, I can talk to your primary down in Phoenix or wherever they're at.
yeah,
And let me explain to them what we're doing so they understand. Because if I talk about a
yeah.
fasting insulin, doctors look at you like, what are you talking about? It's one of the biggest markers we have to prevent diabetes. I
Yes.
mean, it's incredible.
Yeah.
So, things like that. And then when you had knowledge, I'm like, someone else has knowledge of this too? Holy cow. So it's nice when we realize the whole metabolic health and
Yeah.
taking care of the whole patient and not just saying, okay, here's a drug, I'll see it like 10 minutes. And I think hopefully we beat a dead horse on this issue, but it's really knowing, it's really what I've said with patients is, look, insurance is like giving you a bus ticket, right? So if
Yeah.
everyone has a bus ticket, but there's only one bus, it's going to take you a long time to get on the bus. You're going to have to use another form of transportation because you can't
Yeah.
get on the bus. No matter
Yeah.
how good of a bus ticket you got, you can't use it
Mhm.
because no one's taking it. No one, all the seats are taken.
Yeah,
So
yeah.
that's the frustration. I think that's why direct primary care has to be the way of the future. And the point is, and this is what people argue with me when I first left the system. They said, well, Brian, in direct primary care, you're limiting your practice to 300 to 500 patients
Yeah,
generally.
that's
So
true.
what happens to all those other patients? I said, well, if I can make if you're seeing, I had 2,200 patients in my old practice. I'm like, how can I provide good care for 2,200 people? You
Yeah.
can't.
No,
You just
you can't.
can't.
Mm-mm.
So if I could provide excellent care for these people, they're less of a burden to the system, and they're not going to cost Medicare as much as
Yeah,
the people in the system are.
exactly. Correct. It's true because prevention, an ounce of prevention, right? That's what we always say. If you're preventing disease, Medicare is going to be happy about that, you know?
They will be, but the
And we're not
insurers are not
billing,
happy.
well, and we're not billing Medicare, so that's got to make them more happy.
The other thing is, and this is what it blows my mind since we're harping on this for a minute, but the healthcare system, if people are paying for a PPO insurance and
Mhm.
people are coming to us, we're saving that insurance so much money because we're going to
Yeah.
make their patient healthier for them, and
Yes.
they're not paying us. The patient's paying us. We're not getting,
Yeah.
so I don't have to kiss Blue Cross Blue Shield's butt to get
Yeah.
paid $20, right?
And the patients are so much more healthy. I mean, I don't have a patient. I have only one patient who has diabetes. One.
That's great. That's amazing. You
Yes.
must be a great, like, see, like that's amazing. That's an
It is
amazing,
functional medicine. That's what
yeah.
it is. It's functional medicine. If you practice a functional medicine approach, you keep people healthy, you keep them out of the hospital, you keep them happy, healthy. And that's what I love about holistic healthcare because you look at the person from a holistic perspective because every single thing affects every single thing. There's always a cause, there's always an effect. If you know the cause, you know the treatment. So if you're investigating the cause, you know the best route of treatment or at least the best road to be on for that.
And to avoid it. And so if people listening, if we go back to the mechanic analogy, right? Do you
Right.
want the mechanic who's going to tell you, let's change your oil, let's change your, brakes, let's change all this stuff, or do we wait till you blow up your engine and go, oh, we can fix that, right?
Yeah,
No,
yeah.
you want someone like Tammy, like, let me change your oil,
Maintenance.
let me get you on, let's
Yeah,
do the maintenance so you don't
yeah,
blow up your engine, and then you have to get air
yeah.
flighted somewhere.
Right. Exactly. And that's what we do in primary care. We save the system. We do. And we help our communities, and that's what I love. I love Yavapai County. I love
Yeah.
Prescott. I love my patients. I love
Don't
what
tell
I
people.
do.
Don't tell too many people. They
I
might.
know. I know. I don't.
It's a paradise. I know. I'm
It
joking because
is.
I snuck in somehow, but it's a paradise. It's beautiful. If you want to go hiking and camping, and then I could go hiking in the morning, see my patients during the day, go go kayaking at night and watch the moon if I want. I don't care. But it's pretty amazing that just that balance like you're talking about. And I would say people listening, if you're stressed at your job and you're tense and you're bitter all day, especially doctors and medical
Yeah.
assistants and PAs, look for an alternative. You're not stuck in that system. You can't escape. We escaped. We're an example of that. And I tell you, when I did direct primary care, everyone was so happy and helpful. And like, Brian, what do you need? What can? And I helped Deanna,
Yeah.
my partner from San Diego, and said, get out of the system. It's killing you. Like you're beat up. It's not fun.
No.
So seeing people laugh again, and smile again, and
Yeah.
be able to enjoy life, there's something to that for sure.
Right. No. And I don't know. I just love taking care of patients. I feel very fortunate to be living my dream of helping patients to be optimal. And I'm so thankful for the opportunity that I have to do that in the way and the manner that I know is the right way to do it. So, and I love
Awesome.
doing the right thing.
Awesome.
And
And
that's
you
my,
and that's evident. So I'm so glad you got to join me.
yeah,
If
you
people want to
too.
track you down, how do they track you down if they want your services?
Oh, so our phone number is 928-277-1099. Our web address is choosegrace.life. And then our email address is wellness@choosegrace.life. And
All right.
we're in Prescott, so right in Prescott Lakes area.
Oh,
So
awesome.
very
That's
centrally
nice place. Yeah,
located.
that's super
So
nice. I'm down
yeah,
at the crossing, so we're a
yeah.
little bit apart.
Not
But
too far, not
yeah,
too
not too
far.
far. I mean, this
Yeah,
is because we don't have
five,
traffic
ten
here, so we
minutes.
don't worry about it
Yeah, right? Not
compared to where
California
I came
traffic.
from. Yeah, yeah, that's for sure. I
Yeah.
hear people complain. I'm like, really? Like I know people in LA, it will take them an hour to go, a few blocks. You're like, how do you do that every day? That will make me crazy sitting in my car like that.
And
Unless I
it's
have a good
interesting.
podcast to listen to.
I lived in California, but I always lived in kind of rural areas, so I never had to deal with the California traffic that much. So,
Yeah. Yeah, as long as you don't have to go to LA. It's like I want to go to Mammoth. Oh, I have to go to LA to go there. Let me think about it. Can I fly? I don't want to do that. So so
yeah,
what's life's
so
best medicine for you, since this is I think I kind of got a hint of it since we've been talking for the last hour, but what's life's best medicine for you? Where do you go when things are hard? What gets you through the difficult times? What gives you your motivation? Like if you tell someone, look, here's what's important, patient or family member, here's what matters.
um What matters to me, or just what
Yeah, to
matters in
you.
general? To me, well, or what do I like to do for like hobbies or to escape?
Yeah. What's life's best? Where do you go? Ah, this is life. This is living. Like,
So I love dancing. That is
really?
my thing. I am a dancer. I love dancing, and I love the outdoors. So
Awesome.
me and nature are a thing. If I'm out camping or fishing or hiking or just touching grass, that is where I heal. There's something very powerful about the
Mm,
earth and being connected with the earth. And I always tell my patients, being out with the sun shining on you, out with nature, connecting with nature, it has its natural healing abilities. So that's where I do a lot of my kind of magical thought processes and winding
regroup and
down.
re-energize and all that
Yeah,
stuff. That's
that's
awesome.
that's me. And traveling. I love traveling. So I've done a lot of traveling. Not so much lately, because I'm busy
Yeah.
with patients, but I love traveling. I love seeing new cultures, meeting new people, eating new foods, learning. Just when I was growing up, we had a lot of foreign exchange students that lived with us, so I got to learn about a lot of the world through the eyes of teenagers. So it was really fun. So
Awesome.
I
Yeah.
think that's
I
what's inspired me for traveling and learning new things. And
yeah, to see how people do things different, how different
yeah,
lifestyles and how they survive. And yeah, that's, I've spent a
love
lot of time
it.
in Central America, Guatemala, El
Yeah,
Salvador,
yeah,
Vietnam, and just seeing how
yeah.
people live, you go, wow,
It's
wow, it's
amazing.
amazing. It is
Yeah.
amazing. And they look at us like, what's wrong with you people? Like, why are you so stressed? And like, right? It's like that.
Yes.
We talk about the Mediterranean diet, but what about the Mediterranean lifestyle when they help their
Yeah.
neighbors? It's like this living in
Yes.
Prescott is that. It's like, you help your neighbors. You need help. Let me get you started. Like, what can I do? What
Yeah.
works for you? And so that's why I appreciated you too, being kind and nice and saying, okay,
Yeah.
we'll let you be in this group and we could all kind of get along. But as we all
Who
grow
couldn't
together,
not be nice to you? You're amazing. You're
no, it's
this
so
great
sweet. Thank you.
personality,
Thank
and
you.
and
No,
we
it's
have the
fun.
same philosophy. So how could we not?
Yeah, and I think when you say, "Look, we all succeed, we all move up, and we could help people," and there's a huge need
Yeah.
out there. So neither one
Yes.
of us can do it all. So
No.
some of you might get stuck with me when Tammy fills up. You might have to come over, but it's great what you're doing. I'm really excited for you and and this community, and really I hope people. This is something that's really helpful for people to understand what direct primary care and what the difference is and why you would do that and why we do it. I mean, for me, it's selfish because I have balance and enjoyment the most I have in probably my life.
Well, I
Yeah.
work a lot actually, so
Yeah, I
our,
still work,
our,
but it's a difference. I mean, I don't mind
it's
working. I can work,
awesome
right?
work. It's awesome
When
work
you
because I'm
love it,
building relationships. I'm building relationships. I love that.
yeah,
I,
and we get to learn about people's lives and, World
yeah,
War II vets and people who've done so much and,
yeah,
retired fire captains and people who've done plumbing their whole life and they teach you about that. And it's so
yeah.
great that we have the time because we get the reward from that, you know?
Agreed. 100% agreed. And that is what makes a difference. Even though I'm probably working more hours now than I ever did, it's the quality of work, I guess I could say, is just so much more enjoyable because I love working. I'm kind of like, I just love working.
Yeah, we love what we do. And for me, it's not work. I mean, I look at that
Yes,
too. I mean,
it
it's
doesn't
nice
feel
to
like
spend time with
work.
family, but it felt like work for 20 years. It was work. It
Yeah,
was a lot
yeah,
of like, oh, I got to be efficient. Oh, I got to do my charts after everyone goes to bed. And it was like really crazy.
yeah.
But, it's a different thing when you're seeing, and I think this is important. You're seeing people getting better and
Yes.
improving and smiling again, or you're helping their depression or anxiety or their pain get better. That's why we went into this career field.
Yes, exactly. And that is the true payment, right?
Hmm.
Is helping people. To me, that is the biggest reward that I get is when I see somebody who's optimized because of the things that we've done together as a partnership together. I mean, it doesn't just something that I do, the patient does half of what it is that we're doing together. We're together as a partner. And so when I've seen that they're feeling better, they're doing better, they're improving, or they're at least very stable, that is a reward that is just you can't put a you just can't put a price tag on
Yeah,
that.
you can't.
It's
Yeah,
just
you
my
can't.
favorite thing. That to me, that's why I work so hard is for that reward.
Yeah, it's awesome, and it shows, and being happy and enjoying what you're doing. You don't want to be that bitter person who doesn't enjoy it, and they're just going through the motions now. Like, okay, you don't like it, go somewhere else. Like, not we lost that customer service in medicine. That's what DPC is bringing back. That it's
Yeah.
like It's like going to an all-inclusive resort. You go like, I should be paying something for this dinner, but you don't because you already paid for it. But then you don't have a copay when you leave. You just walk out and go, okay, Brian, I'll see you next time. Have a good one. People are
Yeah.
like weird about it. They're like, wait, do I pay someone?
Yeah. Yes, I
Oh, yeah.
agree.
Yeah,
Yes.
your credit card
It's
already paid
so
us. We're good. Yeah.
it's so awesome, Brian. I
You
I'm so happy that that I decided to do this. I think I just feel like this is the way medicine's going. Like you said, there's just not another solution. I don't see another solution. I don't. So
Yeah, doctors are going to listen to this and they go, oh, I want to do that. I want out. So call us if you want out. We can help you. Just don't move too close to
yeah.
us because
Yeah.
we want. No, I'm just kidding. You can. You can. Yeah, we just don't have traffic here anymore and stuff. So everyone, thanks for listening. Everyone, be kind to yourself, be kind to others, and thank you so much for listening to healthcare professionals talking about what life's like and what matters, and all these are the important things. So you get this right, life is better for you. You don't have to see us as often, and you can go enjoy life. And so, Grace Direct Primary Care, what Tammy Frost is doing, I'm really excited about what they're doing. I'm glad that we can all partner up and just make this community healthier, and that's really what matters. So keep plugging along. Everyone have a great, and thanks for joining me late on a Friday afternoon.
Absolutely.
So
Thanks for
now
inviting me.
get
Really
back to
enjoyed
work.
it. All
All right,
right.
Tammy, thank you.
Take care. Thank you.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate that you're helping getting this message out. We think there's a lot of important information. And hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.